I leave the floor to Sigrid Linher, Director, Sustainability and Environment, MedTech Europe.
Thank you very much. Thank you very much for the kind invitation, the possibility to contribute to this discussion from the perspective of MedTech Europe, the European Association of the Medical Technology Industry. The best way to predict the future is to invent it. Alan Kay is often quoted by biomedical engineers. We've heard many examples this morning about striking technology innovations from telemedicine, robotics, wearable devices that confirm the nature of this sector as a thriving, highly innovative sector. And I had also brought some slides, maybe they can be dispelled, that they can show. By the time this workshop will conclude, there will be 4 patents filed, as this sector files a patent every 30 minutes. And the core question is, though, whether these innovations will reach the patient here in Europe. That's another question that's touched upon already partly, but I'll also come to it closer a bit later. But let me just add another biomedical engineering innovation example to the discussion. Imagine hearing and ocular implants that, through digitalization, help restoring senses and allow people to hear or see for the first time. That's the power of MedTech. Or cutting-edge prosthetics for the replacement of limbs. They help no less than replace the critical function of walking. And Europe is actually very strong in this field of upper limb prosthetics and pediatric prosthetics. It's all examples where neural interface technology makes the difference for the patients and enables them living better lives. But digitization, technology advancement also unlock impressive sustainability gains. And I'd like to quote an example of the EU annual single market report. It confirms that the health industrial ecosystem saw the sharpest drop in material extraction over the period 2017 to 2022, namely around a drop of around 60%. Due to this digitization and the technology advancement at product level. And that is very good news for the planet, as in times of global warming and increasingly constrained resources. But innovating for patient and planetary health is the mission and the vision of this industry, with the patient being the North Star. A second characteristic of this sector is it's also highly diverse. We have heard the figure, 2 million different technologies that are available for serving patients' needs, including medical devices. I think you need to, for the slides, you need to go up and up, further up, further. Voila, here you go, with the high diversity of the sector. With the 2 million different medical technologies, I started to quote the 3 groups: medical devices that prevent, diagnose, monitor, treat, care for the people; in vitro diagnostics that help determine the status of person's health; and digital health solutions that are there to help people manage their health condition, to prevent, cure, and heal disease. But it's also a sector, a strong component. We are a strong economic and social impact here in Europe. It's 37,000 companies, 90% of them being SMEs, offering almost 1 million of jobs. Each employee generates an estimated 177,000 added value. And it's a sector with a strong management base in Europe, exporting to the world. We've heard the figure of 11 billion euro positive trade balance. So this high innovation power, coupled with facts of an aging population, increasing health threats, also from the climate change side and other sustainability pressures, will only increase the strategic relevance of MedTech for EU's competitiveness, health, and prosperity. And it's not without a reason that the EU Competitiveness Compass that was presented in January exactly acknowledges that life sciences, to which MedTech is an essential part, hold significant potential for boosting competitiveness. So the message is clear: no health, no wealth, no medical technologies, no healthcare. But the Competitiveness Compass also points to the urgent simplification needs in the medical technology sector. And if you could go to the next slide, some of the challenges I'd like to shortly touch upon. There are many. We can still be proud of the high-performing healthcare systems. It's world-class, efficient, and accessible. And we have a very strong innovative medical technology research ecosystem here. But there are challenges, and the competitiveness gap is widening. Regulatory challenges have been discussed in the previous panel. We also have found that while for a long time MedTech companies innovated in Europe and also launched their innovation in Europe first, we see changes. In our latest survey for the MD sector, the choice of EU as the first launch geography has dropped by 33%. For the IVD sector, it fell by even 40%. And that is coupled with the situation that there is increased R&D spending, however, uncertainty whether these investments will lead to market innovation here. I'd also like to spell out the example of regulatory complexity in terms of how the regulatory system interfaces with other policy domains, sustainability being one, digitalization being one. But for the sustainability side, there is often the challenge of how do timelines for ensuring compliance with new environment regulation fit to the reality of the timelines that are needed for seeking regulatory approval under the MDR when new innovation comes in. There's also a discrepancy and often inconsistency of different definitions and terminology. If we look into circular economy motivations, where you have terminology like refurbishment, remanufacturing, and we have a definition of reprocessing and refurbishment in our sector-specific laws that are different. So there is this synchronization between the different policy domains and regulatory requirements that are a challenge too. That combined with financial challenges, severe underfunding of healthcare system, problematic reimbursement, slow value-based procurement uptake, austerity schemes, they all bear threat of access to and quality of healthcare. And we also see at the same time downward pricing pressures, clawback schemes, and other operational issues such as late invoice payments that can all have an impact on long-term competitiveness. But finally, also some technical challenges, examples that methodologies and standards in support of environment legislation do often not take into account the specificities of the sector, thereby making additional complexity. And it's also, as mentioned before, these timelines matters, which come in on a regular basis. But what can we do? Europe can do a lot to retain the competitiveness. If you go to the previous slide. First of all, the structural reform of the regulatory system was very present. We also advocate for this, and we mean it for both regulations, the NDR and the IVDR. So as the Commission has outlined, the target evaluation is on until the end of the year. And as an immediate outcome, we recommend a package on both of these sector tools, the NDR and the IVDR, so that they can deliver on their regional objective. In terms of 3 criteria, efficiency, innovation friendliness, and good governance. It's also a question of having immediate targeted measures to support device availability, viability, and increase the predictability and accessibility to the regulatory system. So next to the structural reform, this better alignment between different policy domains would be a second recommendation, because this insufficient synchronization today causes legal uncertainty, fragmentation in the internal market, regulatory and administrative burden. A third recommendation would be to allocate strategic investment to healthcare throughout the EU budget. The discussions on the multi-annual financial framework are just starting. So that's an opportunity to think about healthcare in this setting. We also promote implementing value-based procurement, so thinking beyond price criteria, and to think decarbonization and competitiveness planning in a joint manner. Finally, this is all about system change, in particular in the sustainability field. So we need partnerships and collaboration of the different actors. And if I translate it closer to the sustainability side, for MedTech sector's own decarbonization journey, it's really key that there is access to clean energy, clean heat, because they are key decarbonization levers. it's also to prepare and discuss what sector specificities need to be taken into account so that more circularity can come into the system. It's about the synergies that digitization and sustainability can generate. And it is about a single market with more harmonized rules and in particular internal market for waste. Generally speaking, we would recommend designing realistic, patient-centric transition pathways for the MedTech sector and its supply chain, and make sure that this kind of regulatory simplification of the very dense medical regulatory system that you see also here on this bubble slide delivers on securing uninterrupted access to medical technology for patients. So to conclude, let's think patient, let's think investment, and let's think partnership for the transition. Thank you.
Thank you, Sigrid. It's great to see such a strong alignment among MedTech Europe and the community of biomedical engineers and policymakers and commission. I mean, it's a really great momentum as I see it.